Hey everyone, this is Dr. O with Advanced Physical Therapy and Wellness, and we'll be going over some home exercise programs as well as some in the clinic exercises that we'll have patients do. So people are having pain with shoulder flexion and or shoulder abduction, super acute, let's say, and they're like, painful, painful. One way to kind of unload those is just taking a ball on the wall. Interestingly enough, it's super easy. The balls are really cheap. And then so you can have them just work flexion just like this, coming up through here. And then abduction, coming out to the side just like this. And you can kind of do it as a sense of like neuromuscular re-education, so you can have them do it multiple times throughout the day. Or you can have them just do it maybe all at once, just for like 2-3 minutes at a time. They're only gonna do it once a day. You can do both directions. Now that's one of them. Next one is, and this one I found not only like kind of programs get rid of like scapular dyskinesis, but also too, it seems to increase tone in the subscapularis as well as the teres minor, and kind of inhibit a little bit of maybe upper trap and kind of infraspinatus. So if a patient's willing to do it, if they're really interested in the pulleys, might as well just give them a pulley to take home because it's only like $5.99. Not everyone has ankle weights, so you can always have them hang a grocery bag off there and put soup cans in there. One soup can is usually 1 pound. The magic number is usually 3 pounds on this exercise. If they need to, they need a little extra, maybe add 4 pounds or 5 pounds, but usually 3 is the magic number that will eliminate their pain with shoulder abduction. So just working in that scapular plane, not too far forward, not too far backwards, but just kind of right in between. And then this is a neuromuscular re-education exercise, so we'll have them do usually 2 to 3 sets of 3 minutes. Oftentimes I'll end the patient's treatment with this exercise. And then after they do it, then they're like, all of a sudden magically they can go into shoulder abduction. So I usually treat them manually, go into this. Or if they're more interested in this than the ball on the wall, I'll send them home with this because I think personally this is a way better exercise than the ball on the wall. But where I'm getting the pushback and the complaints is patients don't want to set it up. They don't want to take the time to set it up or designate a door for it. So only if they're super interested in it will I give them a pulley. And they'll usually voice that within like 1 or 2 treatments. They'll be like, dude, this thing's so awesome. Can I do this at home? And you're like, yeah, you can. Okay, so lastly, home exercise program, that mobilization with movement that I was showing you earlier, is going to be for flexion, abduction, even working on that aptly scratch, internal rotation, even internal rotation, external rotation, wherever they're having pain. Taking this band, usually it's a black color, but it's not too thick, not too thin. It's usually like the 3rd thinnest. I noticed that the 2 thicker ones are too rough on the patient's shoulder, and 2 thinner ones don't get that shoulder pulling down and back action that we want. So that's how you kind of get it, put it into a door jam, bring them down and back, and then have them go into either shoulder flexion or abduction, whatever usually causes them pain. And if it's still causing them pain, you can have them either step more far forward to really pull the shoulder down and back more, or you can have them, play around with where it's at. You can put it more on the kind of AC joint bias, right in through here on that clavicle, and have them go through it, whatever range was causing them pain, or you can kind of get it coming like just right off that shoulder, solely on the glenohumeral joint, and then have them work in through the painful range. And you can even do that aptly scratch one with the belt coming right in through here too as well. So pretty much anything causing pain, great home exercise program. Empower the patients too. Good to go.